Dr. Humphreys, this is Stephen Sterner doing the student assessment video number 4. In the room, and we'll start with the skin. The skin is light tan. It is smooth and warm. It is intact, non-diaphoretic. There are primary lesions scattered in both upper extremities in the form of macules. The lower extremities, there are some lesions and scattered throughout in the form of macules as well. And they are warm. The skin overall is intact, and there is good skin turgor, no tenting, which is displaying good hydration. Hair distribution, there is normal female hair distribution on the upper extremities. Do you shave?
Yes.
All right, so the legs are smooth, there's no hair present, and there's no signs of folliculitis. Let me see your nails. So the nails are clean, they're smooth, they're firm, they're pink. Capillary refill is less than 3 seconds, and they are adhering to the nail bed. The toes are slightly cooler than the fingers. These are also clean and smooth, no ridging, firm. And capillary refill is also 3 seconds here. The head is spherical. It is proportionate to the rest of the body. It's atraumatic. The hair is clean. The scalp is clean. The hair is thick. It is normal female hair distribution. There's no sign of infestation. There's also no flaking of the scalp. Does that hurt?
No.
Paranasal sinuses, does that hurt?
No.
Good. All right, at this time we're going to check cranial nerve number 5, which is the trigeminal nerve. What I'm going to do is I'm going to have you close your eyes, and when you do, I'm going to have this, and that is smooth, and that is sharp. Could you tell the difference?
Mm-hmm.
Okay, go ahead and close your eyes.
Smooth. Sharp. Sharp. Smooth. Sharp.
Very good. So at this time, we're going to check cranial nerve number 7 is the facial nerve. And if you could frown for me, raise your eyebrows, and then purse your lips, and tongue in cheek, other side. And then smile without showing your teeth, and smile showing your teeth. All right, very good. So at this time we are going to check the eyes. So if I'm looking at the eyes, I see that, they're open. The palpebral fissures are present. They are clearly identifiable. There's no ptosis or lid lag. The eyebrows are full and consistent with the hair on the head. The eyelashes are consistent with the eyebrows and the hair on the head. They are upward and outward bending. The eyebrows themselves do extend past the outer canthus of the eye. The conjunctiva is pink and moist. The sclera is white. There are a few vessels that are scattered. The irides are round and equal. They are green bilaterally. The pupils are equal and round at this point. I'm just going to check your corneas here. And the corneas are clear. The position of the globe, there's no sign of exophthalmos. I'm going to shine this light here and check your pupils. All right, very good. Corneal reflex. All right, and that is equal as well. The light does reflect off of the cornea in the same position in both eyes. Again, the pupils are equal. I'm going to check accommodation now. So I want you to look straight over here, and I'm going to move this from here. Okay, I'm going to come up. Just follow it. Now follow it back here. All right, now follow it into your nose for me. Very good. So they are equal and round, reactive to light, by direct light, consensual, and also to accommodation. We will check the interior of the eye, and this is optic nerve number 2. In checking optic nerve number 2, we would also do a vision test. And that vision test would be a Snellen chart that would be on the wall 20 feet away, and a Rosenbaum chart which would be held at 14 inches away from your vision, and that the Snellen would be distance and the Rosenbaum would be near vision or reading vision. And we would also do the peripheral vision by confrontation. So cover one of your eyes for me. And I'm going to bring this into your field of view, and I need you to tell me when you see it, okay?
Okay.
All right.
I can see it. I can see it. I can see it.
Very good. So we would do this bilaterally. So at this point we will check the retina, the deep structures and of the eye. So just look, and for this test, use the ophthalmoscope. We would have the lights in the room dimmed so that you can actually see the back of the eye better. So just look straight ahead for me. And I do have a red reflex, so I am seeing the reflection off of the retina. So in visualizing her eye, I do see the optic disc. It is a creamy yellowish orange color. There are vessels coming off of that, and it is actually located medially towards the nose or nasally. And there are both arterioles and venules coming out of the optic disc, and the arteries have a 2-to-1 ratio compared to the venules, and they're also a little bit bigger and also slightly more brighter red color. And then laterally, about 2 disc diameters laterally is the fovea densa, and we have the the macula, and in the macula we have the fovea centralis, which is the center of vision. There is no physiological cupping of the optic disc. There's also no exudates or hemorrhage. And we will check the ears at this point. So visually I'm looking at the ears and I'm seeing that they are symmetrical. The skin is the same color as the skin on the face and the rest of the body. There's no lesions present. There's no damage that I can visually see. The auricle rebounds nicely. The mastoid process is also atraumatic. There's and no abnormalities there. So I'll take a look in the eye, or excuse me, in the ear. And the cone of light reflex in the right ear is at 5 o'clock. It would be at 7 o'clock in the left ear. Inside the auditory canal we have some fine hair and also scant amounts of cerumen. The tympanic membrane is a translucent grayish color. There's no bulging, there's no scarring. And the umbo, the malleus, the pars tensa, the pars flaccida are present, and we would check both ears for this. And then we also want to do some hearing tests, and this would be checking optic nerve number 8, which is the acoustic nerve. And so in doing so, I want you to occlude that ear on that side. I'm going to whisper something to you, and if you can whisper it back to me.
Sacramento is the capital of California.
Very good. We would do that bilaterally. I'm going to activate this tuning fork, and I'm going to put it in the midline of your head, and I want you to tell me if you hear this in your left ear, right ear, or both ears. And this is called the Weber test.
I can hear it in both ears.
Okay, very good. Now the Rhine test, I'm going to activate this again, and I'm going to put it on the back here on the mastoid process. I want you to tell me when it stops. When it does, I'm going to move it to the front of your ear, and then I want you to tell me when you can't hear it there. Okay?
It stopped. It stopped.
All right, so that tells us there that we have a bone conduction that is half of the air conduction, or the air conduction is a ratio of 2 to 1. All right, we will check the nose at this point, and the nose is symmetrical. It is proportionate to the rest of the face. There are a few primary lesions in the form of macules on the bridge of the nose and also on the cheeks. The columella is midline. The septum is midline, and it is not perforated. The inferior turbinates are present. The superior turbinates are not. The mucosa is pink, it is moist, and we will check the olfactory nerve, which is cranial nerve number 1 for smelling. If you can occlude one side of your nose and then breathe in. All right, and I'll do the other side. All right, I have some things that I would like for you to smell. I want you to tell me what they are. But you need to have your eyes closed and occlude one nostril for one and then the other for the other product. All right, first one.
That's ginger.
All right, very good. Second one.
That's cloves.
Very good. All right. So at this point, I would like to actually go back and I want to check your TMJ. If you can open your mouth for me. All right, now close it. All right, again. Close it. Very good. There's no crepitus or popping or clicking. This movement is very smooth. And then we did cranial nerve number 7. I'm going to check your neck. All right, so look straight ahead for me. Lift up your chin just a little bit. Swallow for me. And do it again. All right. Trachea is midline. There's no tracheal deviation. The neck is symmetrical. It is proportionate to the rest of the body. I would also like to palpate the cervical vertebrae and the paracervical muscles, paravertebral muscles. And then I'm going to check lymph nodes, and this is pre-auricle, post-auricle, occipital, cervical or superficial, deep, and then the supraclavicular lymph nodes. None are present. If they were, that would be an abnormal finding. At this time, I'm going to check the mouth and the throat. All right. Open your mouth for me. Okay. The mucosa, the buccal mucosa is pink. It is moist. The lips are not chapped. Open again. The inferior frenulum is intact, as well as the upper frenulum. Lift up your tongue. Okay, the glossal frenulum is also intact. Wharton's ducts are freely flowing. And then the Stenson's ducts at the second molars are also freely flowing. The uvula is midline. Open your mouth a little bit wider for me. There are 28 teeth, and there's only one filling that is visualized. Stick out your tongue for me. All right. Now, say ah. All right, very good. The uvula is midline, and it does rise and fall. We also, in doing this, we have checked cranial nerve number 9 and 10. Number 9 is the glossopharyngeal, and 10 is the vagus nerve. and the the buccal mucosa is moist. So we're going to check the lungs at this time. Just looking at the thorax, it is proportionate. It is not barrel chested. Are you having any pain?
No.
No. No masses, no lesions, no tumors present there that I can visually see. There is expansion on inspiration. And at this time I'm going to check for firmitis. When I tell you to, I'm going to put my hands on your back like this, and I want you to say 99 for me. And I'm going to be using the lateral aspect or the ulnar aspect of my hand because it's more sensitive. So go ahead.
99.
Again.
99.
Very good.
99.
Good. And that is present. At this time I'm going to percuss. And I'm hearing resonance throughout. I'm going to percuss for diaphragmatic excursion. When I tell you to, I'm going to lift your shirt up here, okay?
Mm-hmm.
All right. And when I tell you to, I want you to take a deep breath and hold it for me, okay?
Okay.
All right, go ahead. Okay, very good. You can breathe. Sorry about that. And then now lean forward just a little bit more. All right, there you go. Now I want you to exhale. Take a couple deep or normal breaths, and then I want you to exhale and then hold it at the end. Okay.
Mm-hmm.
All right. Go ahead. Okay, go ahead and breathe. And the diaphragmatic excursion is 4 centimeters. And now I will listen to lung sounds. Just breathe normally for me.
Okay.
Lift up your arm. Other side. Very good. Lung sounds are clear and equal bilaterally. If you could lie down for me. All right, at this point we are going to check for the cardiovascular system. And at this point I will palpate for the point of maximal impulse. And there are no murmurs felt. I'm also looking at the chest. I'm looking for any heaves, lifts, or thrusts, and I don't see any that are present. I'll listen to heart sounds. And the first one is at the right second intercostal space, and it's the aortic area. The second is the left second intercostal space, and that's the pulmonic area. And in both of these, S2 is greater than S1. And then it would be it would be left intercostal space, number 3. And then 4. And 3 is Erb's point. And 4 is at the left sternal margin. And then 5 would also be at the left sternal margin. And 4 and 5 are the tricuspid. And then the PMI, or point of maximal impulse, is the 5th intercostal space, mid-clavicular line. And that's mitral valve. And no murmurs are heard. And at this point, I would feel for the brachial and radial pulses. They are both present. And then the popliteal, posterior tibialis, and the pedal pulses. And of course, we would check this bilaterally. I'm going to lift up your shirt here. So looking at the abdomen, I don't see any striae that's present. There are a few primary macules, about 3 or 4, and they are primary lesions in the form of macules. The umbilicus is midline. It is proportionate to the body. It's concave. The abdomen is flat. And I'll listen to bowel sounds. Bowel sounds are present, and they are at 5 to 30. And I'm going to listen for friction rubs over the organs. No friction rubs are noted. And I'm hearing tympany in the abdomen. liver at 7 centimeters, which is normal for 6 to 9. Do you have any pain?
No.
No, the spleen is not freely palpable. It is behind the costal-vertebral margin, so we will not be able to palpate that at this time. The liver, cough for me. Very good. The liver is smooth. There's no nodules. And the border feels smooth again. All right, since I have you here, we will do the musculoskeletal assessment. So if you could lift up your left leg for me. All right, keep it straight. All right, now move it that way. All right, medial and then laterally this way. Very good. All right, now I'm going to try to push it down. You keep it up, okay?
Mm-hmm.
All right, now the opposite, down. Good. All right, now bend your knee. All right, and then I want you to, and this is flexion obviously, and this is extension. So try to straighten your leg. All right, and I'll try to pull it in. All right, very good. Now, extend your toes to the ground. All right, now we have plantar flexion, and then pull them up towards the ceiling. All right, and that is the dorsal flexion. Press both feet against my hands. All right, very good. And at this point, if you could take this part of your foot and put it on this knee, and then let this leg fall out. All right, very good. And then, so we have a rotation of the hip, and then put this knee on this one. Very good. So internal and external rotation. All right, you can go ahead and sit up for me. Mm-hmm. And so if you could cross your legs, put that one on top of the other one, okay, and then the other side. Yeah, so this checks gluteal and hamstring strength and flexibility. If you could stand up for me. All right. So at this point, I want to check your neck for range of motion. So if you can touch your chin to your chest. Good. Now look up. Look up. Very good. So we have flexion and extension and hyperextension. Turn your head side to side. So rotation. And then ear to shoulder. Very good. And then push as hard as you can with your head against my hand. Now back here. All right. Now try to turn your head to the side. All right. Good. Other way. All right. So let's check shoulder rotation. So we're going to have flexion. All right, and then extension, and then hyperextension. Good. All right. Internal rotation. And external rotation. All right. Now, put your arms up here. Pronation, supination. All right. And back and forth. All right. Now, put your hands down at your side. Try to lift your arms against my resistance. Okay, now back. Now out. All right, and then in. Good. Now bend your arms. All right. Now I'm going to try to push your hands down. Keep them there. All right. Turn them over. All right, now try to push down. Good. Now just keep your hands up and then bend at the wrist. All right. Now all the way up. Good. Come back down. And then bend. You know what, let's go back here. All right. Now just bend at the wrist and try to push my hands down. All right. Good. Now spread your fingers apart. Try to close them. All right. Good. Now squeeze my fingers. Very good. All right. So at this point, if I can have you, let me check your back. All right, go ahead and bend over and touch your toes. Okay, so there is a left lateral rotate or a curvature of the spine. Do you have scoliosis?
Yes.
Okay, and you've been treated for that?
Yes.
All right, very good. You can stand up. All right. Now, if you can hyperextend your back. Very good. So we have flexion and extension and then hyperextension. If you could turn, rotate, yep. Okay, that is pelvic rotation. And take your right foot, put it on your left knee, and slide your foot down to your other foot. Very good. All right. So I'm going to have you walk over there, and I just want you to take a normal stroll. All right. Now when you come back, I want heel to toe. Very good. All right. Now let's see here. So here I want to check how fast you can. Okay, very good. Go ahead and have a seat for me. So I'm going to put an object in your hand. I want you to close your eyes. I'll put the object in your hand and tell me what it is. All right, and so this is stereognosis. And so you can close your eyes. All right.
It's a penny.
All right, very good. Now I'm going to write in your hand a number, and I want you to tell me what number that is, okay? So close your eyes again.
An 8.
Yes, very good. All right. And now we're going to do a sensation test, actually. So I'm going to take this. This is sharp, and this is dull. And I want you to close your eyes. I'm going to touch you there. I want you to point to it and tell me whether it's sharp or dull.
Okay.
All right.
Sharp.
Okay.
Dull. Sharp. Sharp.
Very good. Now we'll do a vibration sense test. I'm going to activate this. I'm going to put it on one of your joints, your wrist, knee, ankle. I want you to tell me when it stops. Okay, so close your eyes. You feel it?
Mm-hmm. It stopped.
Okay. Feel it?
Yeah. Stopped.
Good. All right. And now we will do reflex test, and that will cover the triceps, the biceps, the brachioradialis, and the patellar, and the ankle. Relax your hand. Very good. All Very good. That concludes your assessment for today. Thank you for coming in.
Thank you.
Okay. Dr. Humphreys, I'm going to show you the room again. And I appreciate all your feedback, Dr. Humphreys. Thank you very much.